Hospital outbreak management. Introduction. Occurrence of two or more similar cases relating to the patient, place, and time is identified as a cluster or an outbreak. Okay, so at least two or more similar cases at the same time should happen somewhere. So you can say that it is the initial phase of an outbreak. This needs investigation to discover the route of transmission or of infection and possible sources of infection in order to apply any preventive measures, so that investigation should be done to understand which route of transmission is taking place so that this outbreak is happening. Is it airborne, droplet, contact, or other sources? Okay, or there will be one point of source which is causing infection to a large number of people. So investigation is required. So according to that, we can take preventive measures to control further transmission of disease. So if there is a steady increase in cases, for example, today 2 people were admitted, tomorrow 4 people were admitted, okay, with the same symptoms. So you can say there is a steady increase. If there is a steady increase, means what? The incubation period is equal, so that there is a person to person transmission that is taking place. If a large number of cases, around 10 to 15 people, are admitted at the same time, at the same day, at the same time, from the same place they're admitted, okay, large number of people together they admitted, so which can say that there was a shared exposure. All these people got the same exposure, so there was one common source of outbreak through which all these people at the same time were infected. Okay, so that is how we understand there is a outbreak. Two or more similar cases which may lead to outbreak. Other is there is a steady increase or a large number of cases. Okay, now, the first step is recognition of an outbreak. So now you understood that there is a increase in the number of cases of a particular infection, and there is a rise of prevalence of that organism among that population. So you understand, you recognize that there is an outbreak going on. And next, under the step 1 is preliminary investigation. So what happens in the preliminary investigation is, first you have to make a case definition. Okay, what are the symptoms, signs and symptoms which will come under this case definition? What are the incubation period that should come under this case definition? Okay, so these are case definitions will vary from identifying the site, pathogen, affected population, etc. And the definition will contain the outbreak in time, person, and place. So these all things will come together as a case definition. Then there will be determine the magnitude of a problem. So measures such as if it is taking place too soon, so many people are coming with the same symptoms within the small time span. What you have to take is you have to take immediate measures such as isolating all the infected patients, or putting all the infected patients together, cohorting the infected patients together. Okay, and then verification of diagnosis, which means that after when you cohort the patients, you have to make sure that they come under the same case definition. If not, you have to separate those patients which do not come under the case definition. So that is verification of diagnosis. Then there is confirmation of outbreak. So it will how you will confirm the outbreak is comparing the present rate of occurrence, like within 2-3 days how many patients are getting admitted, or how many cases are showing up. You have to compare that number to the endemic rate. Endemic means what? There is a certain infection which is common to a particular region. For example, malaria is very common among the tropical regions. Okay, any mosquito related or vector borne diseases are very common in the tropical regions. So that is endemic there. For example, chickenpox is endemic to UK, but malaria is not. Okay, so that's one example. So you have to compare the endemic rate and the current rate. So if it is the same, means you can understand the outbreak is going on. Now, next is steps to investigate an outbreak. Notify notify and involve appropriate departments, personnel, and hospital administration. Okay, what happens here is some extensions of the health ministries will be there at local government level. Okay, so though they have to be notified if an outbreak is going on. District hospitals have to be notified. Okay, and these are the key areas where and departments and the personnel, the local collector or the regional health minister, health officers, they have to be notified. No, step 3 is search for additional cases and clinical microbiological records. Okay, you have to keep searching on the new incoming patients from OP level. Also, you have to see any new patients are coming or not with the same symptoms. Okay, and then line listing has to be done. Line listing means what? Each case under the case definition, who comes under the case definition of this outbreak. Each case, their name, place, time when they were admitted, from when the symptoms were showing. Okay, for each case, all this information will be collected in a tabular format. So that is line listing. You develop an epidemiological curve. So in epidemiological curve also, place, time, occurrence, everything will be mentioned. Okay, and also features like sex, gender, exposure to various risk factors, underlying disease. These all information will be also considered when you want to draw an epidemic curve. Okay, so to understand that which group of population is has a high risk of exposure to this particular outbreak. So accordingly, gender wise, age wise, or underlying diseases wise, you can take preventive action. Then you have to formulate a hypothesis. So hypothesis is based on literature search and features that is common to the cases, and it should be formulated about suspected causes of outbreak. When you are formulating this hypothesis, you are not completely sure about the pathogen or the causative agent, but you have a speculation in mind. Based on that speculation, the hypothesis is formulated, and then you work towards finding that particular pathogen or that particular route of transmission. Okay, so that's how from speculation you go into proof, that is formulating a hypothesis. Then microbiological investigation should be done, and microbiological cultures from all the cases under the case definition, all the carriers, if any, from all the environment, if it is source, outbreak, etc. So these all microbiological investigation should be done, and then testing the hypothesis. Case control study, cohort study, microbiological study. Okay, these all studies can be conducted to test the hypothesis. In case control study, you will find out the cases first, and then you will move forward. What is going to happen in that cases, and how they are going to recover, how they are going to respond to a particular treatment or not. In cohort study, you have already identified the patients from past, okay, who have already got into this, who have already been suffering from this outbreak in the past patients. Okay, from there you will draw your analysis and investigation. Microbiological study, it depends upon the cultures that has been procured from the patients. Now steps to investigate an outbreak. In step 4, you have to implement specific control measures, monitor for further cases and effectiveness of control measures. When you understood what is a specific pathogen which is causing, or specific route of transmission which is causing an outbreak, according to that, specific control measures will be put into place. After that, you have to see if it is effective or not. Whatever control measures you're taking, is it working or not? And then what all data you have collected, okay, what is the ongoing procedure, what is going on present, and everything has to be reported to the hospital infection control committee, and all the departments of the administration should be involved. So this is the step 4. Then intermediate control measures. When control measures should be initiated during the process of investigation. You will not wait till finding the pathogen or finding the source of transmission and then start the control measures. You can't do that. You are risking more and more people's life and health at stake. So as soon as the outbreak, you have a speculation of outbreak, control measures should be put into place. These are general control measures. Okay, so this will include strict hand washing among the staff while treating patients, intensification of environmental cleaning and hygiene, and adherence to aseptic protocols like using PPE while handling the patient or patient articles, etc. Strengthening of disinfection and isolation policies within that hospital or ward. Okay, so these are the general measures which will come into play before you come to a conclusion of a outbreak. Then microbiological studies carried out to identify possible sources and routes of transmission. This investigation will contain cultures from other body sites of the patient, cultures from the body sites of other patients, cultures from the staff to see if anyone is a carrier or not, cultures from the environment, if it is a source-based transmission or not. Okay, so these are the areas where microbiological study will come into play. Then specific control measures. Okay, after you have understood what is the exact causative agent, what is the pathogen here which is affecting the risky people, and also if you have understood what is the source here, okay, route of transmission, specific control measures will be put into place. Then this needs to be instituted on a basis of nature of the agent, characteristics of high risk group, and possible sources. Okay, these measures may include identification and elimination of contaminated product. Okay, what is contaminated, what is causing the infection, that has to be eliminated. Okay, if it is an inanimate object, modification of nursing procedures. So now nursing procedures will be specific to contain that outbreak. Identification and treatment of carriers, if any. Rectification of lapse in the clinical technique. For example, if it is because of a clinical procedure gone wrong, an outbreak took place. Okay, for example, in a MRSA or a VRE cases within a hospital. Okay, so that rectification has to be done so that it is not repeated in the future. Evaluation of efficacy of control measures. So every control measures which you have took, it should be evaluated that it is working or not, it is helping to decrease the case or not. Okay, continued follow-up of cases after the outbreak should be done to check that whatever treatment you have given, whatever control measures you took, it worked or not. Measures are clinically effective if the cases cease to occur. Okay, after taking proper control measures, specific and general, you see a very drastic reduction in the outbreak curve. Okay, in the graph you see a very drastic dip, means your control measures were efficient enough. Outbreak should be documented and records should be kept in with the hospital infection control committee, and it should be presented at the hospital infection control committee meetings. Okay, so records should be kept and proper review and analysis should be done at the infection control meetings.